All right. So let me see. All good. Good, Dr. Muaz. And how about the others? We had a break. And yeah, we are coming back with all energy, inshallah. Dr. Isra,
Yes, doctor.
Dr. Isra, you are in the 1st of October, right?
Yes,
Okay. How are you doing?
I'm burning from inside.
I can hear that. Don't worry, all right? So, just don't take it like an exam. It's just a practice. We are focusing on your mistakes, how to improve them, and that's it. Okay? Do
Yeah.
as much as you can mistakes. I never mind at all. Okay? It's better to have mistakes here rather than having the mistakes in the exam. Okay?
Okay.
Yeah, let me share the questions. Okay, Dr. Isra. So we are going to start now. Can you see the first question?
Yes.
Okay. Can you hear? Start.
Yeah. Hello, Isra Mitwali, GMC number 123456. Hello, my name is Dr. Mitwali, one of the doctors working here. I'm speaking to Mr. Luke Wales.
Yes, doctor.
Is it okay to call you Luke today?
Well, yes, you can call me Luke. Luke's
Nice to
fine.
meet you, Luke.
Thank you, doctor.
Could you confirm your age for me?
Um, I'm 35.
Well, I can see that you presented with fever. So could you tell me more about that?
I don't know, doctor. I've been having this high temperature for 2 days now, and
Mhm.
it's not going down. I don't know what's going on.
I'm sorry for that. Is it the first time you experienced such fever?
Um, Such fever, yes, 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 it's very bad.
And can you think that anything happened before that?
Nothing specific that I can remember. Nothing, doctor.
Is it all the time or just come and go or coming in a specific time at the day?
No, no, doctor, no specific time. It's just I'm taking paracetamol. Paracetamol sometimes helps, and then when the time for the next dose comes, I feel feverish again.
Mm-hmm. And nothing make it better except the paracetamol?
No, doctor.
And you feel yourself is getting worse?
Yeah, yeah.
Oh, all right, okay. And so could you tell me, do you have anything else bothering you?
Yes, muscle pain. My body is aching.
I'm
Yeah.
sorry for that. And regarding the muscle pain, did it start with the fever?
Yes, doctor.
hmm And is it resolved also with the paracetamol?
Yeah.
Okay. And have you noticed any you're feeling discomfort with your neck when moving it?
No.
Any rash, any part in your body?
No rash. No.
hmm And have you noticed any cough,
No cough.
any headache,
No.
any pain while passing urine?
No.
All right. And were there any thing with your bowel, any bowel changes?
No, doctor.
hmm were there any weight loss recently?
No. No.
Any bumps or lumps, any part in your body?
No.
All right. And have you noticed any early morning vomiting?
No, doctor. I didn't vomit. No.
Any sore throat?
No.
All right. No symptoms of like sneezing or like this?
Yeah, I do have some, runny nose with the fever and the muscle pain. Yeah.
And you feel that the secretion from your nose. Could you describe it, the color of it?
Clear.
Clear, yeah. And is it a lot like continuous, like any common cold?
Yes, like the common cold, yeah.
Mm-hmm. And do you have any like vomiting or
No,
heartburn? Mm-hmm. All right. Okay. So, okay, regarding your general health, do you have any medical condition?
no, doctor, no,
Do you take any medication?
no, just paracetamol.
Anyone in your family member having similar condition?
No.
Mm-hmm. And could you tell me what do you do for a living?
Um, well, I'm working in an agency and you know, we do conferences and just office work and yeah, these things.
Mm-hmm. Did that affect your job by any?
Um, and no, it's just, you know, the for 2 days I didn't go to the work and it's okay, it's fine.
Do you have any allergy?
No, doctor.
All right. Well, I can see that having fever that just decreased with paracetamol is quite something worrying. So, how are you coping with that?
Well, I just need anything to help in this muscle ache, and I want to know what's going on. Why do I have this fever?
I'm sure we're gonna address your concern. And do you smoke?
No,
Do you drink alcohol?
no.
Okay. Was there any history of travel recently?
Yeah, recently I traveled to Uganda.
Mm-hmm.
Yeah,
Uh,
yeah.
all right. Okay. So, and before travel, have you taken any prophylaxis regarding traveling?
Yeah, I took the vaccinations and the medication uh, for malaria.
Mm-hmm. And for how long do you take these medications?
Well, I took it before going to there, and then I think I stopped it in the middle.
So you don't complete it after you return back.
No.
Have you noticed if there is any insect bite during your journey?
Well, I'm not sure. I'm not sure. There are insects everywhere there, so maybe I got it. Yeah.
And have you noticed any discoloration of your eye?
No.
Any change in the color of your urine or stool?
No.
All right, okay. So, do you have any idea what might be going on?
No, doctor, but now you asked about the travel. Is it malaria, doctor?
Well, I'm not sure about that. I just gonna complete my examination and explain everything to you.
All right.
Okay.
Okay.
Do you have any other concern at the moment?
Uh, no, doctor. No.
All right. Okay. So, thank you for answering all my questions. Now I would like to check your observation. All right. Okay. So I can see that you have an elevated temperature. Um, well, I just gonna prescribe you and first of all, well, I suspect that you have malaria. For this, do you know what's malaria? Is it
Yeah,
right?
doctor, I know it. So, how did I get it? Well, I took everything, my precautions and everything.
Well, I know that, but the precautions and the antibiotics should be completed after for 2 weeks after you return back from your travel.
Okay. Is it
Uh,
serious, doctor?
well, let me reassure you, this is a manageable condition, nothing to worry about. Just need to immediately refer you for admission for the
Time's up.
hospital.
Time's up. Thank you, Dr. Isra. Thank
Here's
you
the two
so
minutes
much.
down.
How do you feel?
I feel awful. I'm not sure about everything.
Okay, so so I think that you were a little bit, got lost in at the early stages in the case, okay? And then once you asked about travel, then everything
Is it malaria?
became better. Yeah, it could be malaria. Yeah, you
I
don't know.
didn't.
You don't know now, and you didn't do any investigations, but most probably it is malaria. This is the only positive thing in the case.
Oh my
Okay.
God.
So from the case that we have done now, what is the lesson to be learned in any case of fever?
Travel history will be the first thing.
Yes, you have to consider travel history in all of the cases of fever, please. Another thing, you did it. The second one that you have to consider, you did it. Any case of fever, what you need to ask
Recreational
about.
drug.
Sorry?
Recreational drug.
It's not me. I don't. It's not me.
I didn't hear.
It's not me. The
Oh, okay.
voice from anyone else.
All right. Systemic review. Okay.
Yeah.
Take the
Yes.
patient from up downwards in the present history, and please in the past history with the travel, MAFT. We have in the past history that happened before, any medical conditions, any medications, any allergies, any travel history, please, in any case of fever. Okay. If the patient has a positive history of travel, especially in Uganda, or any place with malaria there, so you can say it could be malaria. If there is no travel history, okay, you can think about anything else. Most probably the other case with fever is rheumatic fever. So consider that in your mind. Infective endocarditis, especially if the patient has a heart murmur. Okay, so first of all, you have to consider asking about systemic review from up downwards, as Dr. Isra did. Asking about travel history, please. And in the examination, please think about heart examination to exclude infective endocarditis. Okay? So this is the lesson to be learned in this case. Hopefully in your exam, you will deal with the fever case very well, Dr. Isra. So what I can comment on is that in greeting or in the starting the station, it's always better to say, would you like me to call, what would you like me to call you? And instead of telling him, can I call you, blah, 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 sometimes the person or the simulator might be, not very friendly. Then he tells you no. All right. It's fine, but it's better to say, what would you like me to call you? It's
Okay.
not a big problem, but I'm telling you the
Yeah.
best idea or the best option. Okay.
Okay.
All right, this is in the greeting. Then in the present history, you explored the fever and you asked the patient about rash and cancer symptoms, which is okay. But usually cancer symptoms are in, chronic fever rather than acute fever for 2 days. If you ask it, it's not a problem. If you skip them, it's not a problem as well. Okay,
Yes. Okay.
because the issue here is acute fever. It is infection. There is an infection there in the patient's body. Okay, you took the patient from up downwards, and then you moved on to the past history. You didn't ask the patient if he's feeling well in himself or not, if he's lethargic or not, just to exclude sepsis. Okay, and
Mm-hmm.
you can exclude sepsis from the
From examination.
vitals.
Yeah.
Okay.
Mhm.
Then in the past history, did that happen before? Let me share with you um, the mind map of this case quickly. Uh, can you see the portal or not?
Not yet.
No, okay, just give me a second. Mm. Malaria is page 7. Just give me a second. I will share this. Advanced. Okay. Mm. Can you see that?
Yes.
Malaria is 23.2. Yeah. So can you see that, doctors?
Yes, doctor.
All right. So this is the case of malaria. Okay. What you need to ask in the case. Okay, I'm going with the mind map now. We've finished the greeting in the present history. In the past history, Dr. Isra, um, you didn't you asked me about if I had this fever before. You asked about medical conditions, medications, allergies, and any family member in the home, which is good. Then you went lost. You didn't ask about the travel. Can you see that here?
Yes, yes. I
Okay.
remember it. Yes, was the yeah.
All right, so I'm sure that in the exam, if you have any case of fever, you're not going to miss asking about travel. Personal history is not important here. No need to ask about cigarette
Smoking and
smoking or alcohol drinking or these things. Okay, in psychosocial, you can consider asking about. You asked about others at home. If you were, if you don't know, is it malaria or not? Usually, malaria is not infectious. Okay, but you can
I was
ask.
mhm.
Uh, sorry, you want to?
No, 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 it's fine. It's fine. Okay.
Yeah. So malaria is not infectious, but you can ask the patient, is there anybody
Mhm.
else traveled with you from your
Yes, yes,
family members?
yes, yes.
Sometimes the patient might ask you, so I live with my family, so are they going to get malaria? Do they need to take any vaccination or any precautions? Okay,
Mhm. Mhm.
so this question is important. Did they travel with you or not? If they did,
Mhm.
if they didn't travel with you, with him, no need for uh, um, worries. Okay, it's not infectious. Um, ICE, ideas, concerns, and expectations. Then you examine the patient. Please do not miss examining the abdomen, please.
Mhm.
And then you move on. You can investigate the patient before going to the management. You can take basic bloods, sepsis screening, and urine test. Okay. And then you move on to the management. You tell him that most probably it is malaria. When I told you, is it malaria, doctor? You told me I don't know,
I'm
right?
not sure. I
I'm
told
not
I'm not
sure.
sure. But
Uh,
I shouldn't
it's
yeah, I shouldn't tell you like this here. Just after examination, I can a bit
yeah. Yeah, you tell me, well, okay, until now, we can't confirm is it malaria or not, but let me assess you first, and then we can talk about what might be causing the
Yeah.
fever. Okay?
Yeah.
Um, uh, then you can tell him that there are many causes, most probably, as you thought, it could be malaria because you traveled. This is the only thing in your history. It could be something else, but we will need to exclude malaria as a cause of fever. Okay, if we don't treat malaria right away, you might have complications. So it's very important to exclude it and treat it if it's confirmed. Okay. Then you can admit the patient if the patient is unstable. Here in this case, the patient is stable. You can just take an advice from the infectious diseases department, and ask them to come and assess the patient and do the investigations, and then the patient can be treated as an out patient. He can take the anti-malarial treatment at home with close monitoring. Okay, in this case, if the patient is unstable, then the patient should be admitted and get the treatment in the hospital. Okay, the most important thing in the treatment, starting anti-malarial medications, and please notify the public health. Okay, he might have the concern of I live with my family. Are they going to have malaria? Is it serious, doctor? What are you going to do for me? So all of these questions, the answer of them are here. Okay.
Right. Okay.
All right. If I would give you marks in the case, where is it? In data gathering, I would say 2. You were hesitant in asking the questions. You were lost. Management skills, you didn't have the time to.
I didn't hear the 2 minutes bill.
Well, I told you 2
Oh,
when I
all
was
right.
talking with you.
I,
All
I
right,
didn't.
it's fine.
Okay.
It's fine. It's fine. You took too much time in
Yes.
the history,
Yeah.
because you were you didn't know what would be the cause. Okay. Management skills, I would say 1. Okay. Interpersonal skills, I would give you 3. Your interpersonal skills are good. I do not have a comment on them. Okay. You were reassuring, and you answered my questions. Just the concern, just don't tell him, I'm not sure. Tell him, okay, let's see. Let me examine
Mhm.
first, and then we can see what's going on. Okay, I would give you a tick in the consultation and tick in the examination. Please examine the heart. Please, if the patient doesn't have any travel history. Okay. And to be
So if the patient doesn't have a travel history, all I came to my mind is just a common cold, or
It
it's
could be. Why
yeah.
not? It could be. Yeah. Okay. I take in the management. Okay. And take in the time box. All right. So this is in
Okay.
terms of the malaria case. Okay, Dr. Isra. Well done.
Okay.
I'm happy that we did the case. Now everyone here knows how to deal with any fever case. Okay. Let's do the next case, doctors. We have Dr. Riham.
Hello, doctor.
Dr. Riham,
Yes.
your
No,
exam.
I am Arwa. I have a question.
All right.
Doctor, my question is for Doctor Itra. She asked about the morning vomiting with the fever. I want to know why.
Well, I think she were trying to exclude something in the brain.
Okay. Okay.
Okay. Um, it's not necessary in the case. Okay?
Well, yes,
Okay.
I'm sure it's not necessary, but when I didn't figure out anything
Yeah,
common, so I'm gonna go for the red flags, just
yeah,
the things that's
Okay.
serious for anyone.
yeah, yeah.
Just want to know if I miss anything
No, no,
about
you
No,
the
no.
you
morning
didn't miss.
vomiting.
You
Okay.
didn't
Thank
miss.
you. Thank you.
All right. Okay. I'm going to answer the questions at the end. Don't worry, doctors. So let's move on to the next case. Dr. Riham,
Yes,
are you here?
yes,
9th of October, right?
yes.
Okay. So let's do the next case. Do you want to switch your camera on?
No.
Okay, no worries. So you have the question now. Start. Do you hear it begin?
Hello, I am Dr. Riham, one of the treating doctor here in general practice. Could you confirm your name, please?
Yes, doctor. I'm Maria Thompson.
Well, Maria, how can I call you today?
Maria is fine, doctor.
Okay, Maria, could you confirm your age?
I'm 55 years old.
Well, nice to meet you, Maria. I understand that you came here to seek the blood test that you done last time. Is that right?
Yes, yes, doctor.
Okay, and could you tell me why you did this blood test in the first place?
Well, doctor, I'm having tiredness for a few weeks now.
I'm very
Yeah,
sorry for that.
yeah, no worries. And I asked my GP and he told me, okay, we can do some blood tests to check what could be the cause of tiredness.
Okay, and is there anyone explain to you these results or not yet?
No,
Okay, don't worry. I will explain to you everything, but before that, I just want to ask you many questions to get a better understanding of what happened exactly. Can I do this?
okay, doctor.
Okay, could you tell me, you mentioned that you have tiredness. Can you tell me more regarding this tiredness?
Well, it's for 3 weeks, 3 or 2 weeks, so I can't remember, doctor, but it's a few weeks now, and it's persistent. I can't do my work in the house. I don't do my house jobs. All what I do is just lying down on the couch.
Okay, I understand this. And apart from this tiredness, do you experience any drowsiness?
No,
Do you feel lethargic sometimes?
no,
Do you have any muscle weakness
no,
or cramping?
no,
And do you have any nausea or vomiting?
no,
Do you have any headache?
no,
Do you feel that you are confused or restlessness?
no.
Okay, and could you tell me, is this the first time that you experience this type of symptom?
Well, I was having tiredness. I was diagnosed with depression 4 months ago, and I was tired because of the depression. They started me on talking therapy with no improvement, and then they started giving me citalopram as a treatment for depression, and my mood is okay now, but the tiredness is getting worse.
Oh, well, and you mentioned that you diagnosed with depression 4 months ago. Is that right?
Yeah.
Okay, and I just want to assess your mood. How is your mood now?
My mood is okay.
In a scale from 1 to 10, 1 is the least mood and 10 is the good mood. How would you score your mood?
Well, I can say 9 or 8.
8,
Not very
okay.
bad.
This is quite reassuring. And regarding citalopram, for how long do you take it?
I started it like maybe 3 weeks ago.
3 weeks, okay. And since you started, do you experience any new symptom?
No symptoms, just the tiredness. It's getting worse.
And do you experience any dry mouth or dry eyes?
No,
Okay. Apart from, and do you take your citalopram regularly?
Yes.
Okay. Apart from this depression, do you have any other medical condition?
Yes, I have high cholesterol and I'm taking simvastatin for it.
Okay. And any other medication that you are on?
No,
Okay. Have you ever had any heart problem or liver problem before?
no,
Are you in any diuretic or water pills medications?
no, no.
Okay. Do you have any allergies?
No.
And what do you do for a living?
I'm a housewife.
Okay. And can you tell me about your diet?
Uh, well, my diet is okay. I'm trying to eat healthy, fruits and
Okay.
vegetables, grilled food. Yeah.
Mm-hmm. And what kind of exercise that you are able to do?
Well, I'm not practicing exercises, to be honest.
Due to this tiredness?
Not in general, I don't practice exercises.
Okay. And what about smoking? Are you smoke or not?
Well, yes, I do smoke.
Mm-hmm. How many cigarettes per day and for how long?
Uh, maybe 10 cigarettes per day for 10 years now.
Okay. And what about smoking? What about alcohol? Do you drink alcohol or not?
No, doctor.
Mm-hmm. Well, Maria, do you have idea what might be the cause of the problem?
No idea. No, doctor.
And is there anything specific you are worried about it?
I just need to know why I'm getting more tired despite taking the medication and my mood is getting better.
Well, don't worry. I will explain to you everything about this at the end of the consultation. Now, just could you tell me how this symptom affected you?
Well, I don't do my house jobs. I just want some energy to
Mm-hmm.
work.
Well, I understand how this could be very difficult for you. Now, I just need to examine you. I need to take your heart rate, breathing rate, temperature, and blood pressure. After that, I just need to do general physical examination to make sure that everything is okay.
Yeah, examinations are normal.
Well, thank you for letting me examine you. After examination, just I need to explain to you the result. Your blood test result shows that your sodium level is quite low, which is about 128, which is low. So
2 minutes.
we think that you have something called hyponatremia. Do you know what is it and could be the cause of it?
No, doctor, what is hypo?
Okay, hypernatremia, it is a decrease of the sodium level in your body. This could be related to citalopram that you take, as it have many side effects. One of it decreases the level of sodium in your body. How do you feel regarding this?
Well, is it serious, doctor?
Actually, it is quite serious, but it's manageable condition. Just because you are experiencing these symptoms, we need to admit you immediately to hospital. So we need you to go to hospital immediately.
Oh my God, I was not expecting that, doctor.
Well,
It's
I see.
serious then.
I see you are worried, but I just need to assure you it is just manageable condition, but we are worried about the level of sodium in your body. So we need you to go to hospital to correct the level of sodium first
Okay.
in your
So
body.
why did I get this thing?
Okay. This is related to antidepressant medication that you take it. So also we need to change your antidepressant medication to you with another medication, which is called amitriptyline.
Time's up. Okay. Thank you, Dr. Arwa.
Reham.
Dr. Riham, right?
Yes.
Okay, thank you, Dr. Riham. So, well, how do you feel?
Hesitant.
Hesitant?
Mm.
No, to be honest, you were not hesitant. No. You were talking fluently. You asked the questions without hesitancy, to be honest. But you asked too much questions.
Mm.
Too much questions. We are going to talk about the case, how to deal with it. But this is what was this was the main problem. If you cut down your questions, this would be better. Okay. So anything else you want to add?
No.
No. Okay. So, well, this case, is it a history-based case?
No, because we know the case from the beginning.
Yeah. It's test results case. Okay. In test results, we don't deal with it as if it is history-based. Okay.
Yes.
You ask too many questions. Okay. Everything is explained in the question. Okay. The patient has hyponatremia, and the cause of tiredness, most probably or 100% is the hyponatremia. Okay. Potassium level is okay, urea is okay, creatinine is okay, hemoglobin is okay, everything is okay apart from the hyponatremia. So in your history taking, your aim is searching for what is causing the hyponatremia.
Yes.
Not what is causing the tiredness. Okay. You asked me about nausea and vomiting, headache, cigarette smoking, alcohol, exercise. So do you think all of these are helpful in the case?
Actually, because exercise, I want to know the effect of tiredness in her activities. So I ask about exercise. I'm not sure about smoking alcohol, actually.
Okay, you can ask, if you want to ask about the effect, you can ask, how have you been affected by this, instead of just taking time to ask about exercise.
Yes.
She's exercising or not. Is this going to change the management?
No.
Okay, so this is what you have to think about, or your mindset in the case, in any test result case. You think about the abnormal finding.
Yes.
And your data gathering will be around the abnormal finding, nothing else. Okay? If you think that the question that you are going to ask is not going to help you in the management, don't ask it. Don't waste your time. Okay? You waste time in asking nausea, vomiting, headache, alcohol, smoking, exercise, asking again about the effect of the problem. So all of these are, points that can be avoided, or can be taken out to avoid wasting of time. Okay. So let me share the hyponatremia. Where is it? I'm not sure if it's in the tiredness, I think. Tiredness, I think it's in tiredness. Yeah, this is the hyponatremia in general. It's not specific to the case, to this specific case, but in general. Okay. In the present history, I think this is no, this is not test result. It's in the confusion, I think. Hyponatremia 25. Okay. So multiple. So it's like this map. Okay, it's a test result case. You ask the patient, why did you do the test results, and then the symptoms and causes of the abnormal finding, hyponatremia. So you ask about hyponatremia. Since when you have this tiredness, is it getting worse or getting better? No, it's getting worse. Okay, so what are the causes of hyponatremia, doctors? What are the causes of hyponatremia?
Okay, could be related to any liver problem or heart problem, and could be SIADA due to lung cancer.
Yeah,
Could be a type of medication side effect like diuretic side effect or antidepressant side effect.
yes, good. All right. So these are the main causes. If we just think about hyponatremia, there's acute hyponatremia and chronic hyponatremia. Okay, this is the first thing that you can think about. In this case, it's acute for 2 weeks. It's not very chronic. Okay, and there is eovolemic, hypovolemic, hypervolemic. Okay, eovolemic let's talk about hypovolemic first. In hypovolemic, the patient has hypovolemia. So what can cause hypovolemia? Nausea, vomiting, diarrhea, diuretics. Okay, and subarachnoid hemorrhage sometimes can cause hyponatremia because of losing of blood. Okay, this is in general. All right, eovolemic medications and syndrome of inappropriate ADH, SIADA or drugs. This is in eovolemic. In hypervolemic, there is volume, extra volume in the body, heart failure, renal failure, or kidney failure. Okay? So this is a quick overview. In our history, how can we address all of these causes in the mind map or in our structure? Okay? In the present history, you ask about the tiredness. Since when you have tiredness, is it getting worse or not? Okay? All right. Then symptoms and causes of the abnormal finding. What are the symptoms of hyponatremia? She has tiredness, confusion, and fits. Confusion and fits. Do you feel like you are not concentrating very well? Do you feel any did you have any fits at all? Okay, so these are the symptoms of hyponatremia. Okay, causes of hyponatremia. In the present history, you don't need to ask about anything, to be honest. In the past history, did that happen before? Any medical conditions in your heart or kidney or liver? If you would like to ask. In the investigations, everything is okay. They excluded the kidney problem, and you can ask any problem in the heart or in the liver. Okay? Then what else? Any medical conditions, then any medications. Any medications. Most probably the hyponatremia in this case, in this patient, medication. In medications, what could be, what else in medical conditions, doctors? We can ask. What else?
Can we ask about history of bulimia?
Of cancer.
Cancer.
Lung cancer. Okay? Especially lung cancer, to exclude SIADA. Okay? And then medications. Usually the patient might be taking thiazide, diuretics, or SSRI, which is one of them is citalopram. Okay, antipsychotic or anti-depressant medications. These are the most common medications that can cause hyponatremia. There are other medications, but these are the two most common causes of hyponatremia, antidepressants and thiazide diuretics. Okay, the patient doesn't take any thiazide. The patient is taking citalopram. Most probably this is the cause. The patient is taking citalopram. Then you can tell her, all right, I can see that. You can ask her, do you have any medical conditions? She would tell you, I have depression. Or you can ask her, well, I can see that you have depression. I'm really sorry to hear that. And you are taking citalopram for it or medication for it. Could you tell me, is it written here in the question? Yes, it's written. So I can see that you have depression. I'm really sorry first to hear that you have depression. And you are taking citalopram. So since when you are taking citalopram, and is it improving the symptoms? How do you feel about your depression? And that's it. Okay. Then you move on to the psychosocial. Here in the case, you don't need to ask about smoking, alcohol, lifestyle, and these things in this specific case. Okay, they are not going to help you. Did you mention anything about the lifestyle, smoking, drinking, alcohol, and anything in the management? What is the management? You can send the patient to the hospital if you would like to be safe, extra safety. Okay, but in this case, the patient is stable, only tiredness. As per the new guidelines, the patient can be treated as an outpatient patient. Okay. But if you want to be extra safe, you can send the patient to the hospital with reassuring him. You reassured me. Okay, you did the right thing. Sending me the hospital with reassuring me, which is good. Okay. Then you talk about what will happen in the hospital. All right. Stopping the medication. They will take an advice from the psychiatry, giving you another medication to avoid this from happening again. They might give you fluids to correct this level of sodium. Okay. They might restrict the fluids that you are taking during the day. All right. And they are going to monitor you. This is how you are going to treat this patient. If you would like to treat it, this case as an outpatient, you can. It's fine. You can tell her we will keep monitoring you, and it's very important to restrict your fluid just up to 1.5 liter of fluids per day. Okay, drinking. Yeah. And we will need to stop citalopram, and I'm going to talk with the psychiatry to give you an alternative right away. So you can talk with the psychiatry team or with the senior to give her another medication. Okay. So this is the treatment in general. All right. If I can focus on your problem, Dr. Riham.
Yes.
You dealt with this case as a history-based case. All right. This is the first thing. You asked too many questions in the data in the history taking. All right. You asked relevant questions and you didn't reach the management. Okay. So if you can focus about something in your performance, thinking about the situation and how to select and filter your questions based on the case and on the context.
Okay.
Okay, Dr. Riham?
Okay.
All right, this is the main problem. I'm sure that in the management you would talk about in the hospital management, what would they do in the hospital, but the time didn't allow you because of the data gathering. Interpersonal skills is very good, to be honest. You were reassuring. You were addressing my concerns, so no problem in the interpersonal skills. The problem is in the
Data gathering.
data gathering, how you gather your data perfectly to the point based on the situation. Okay? Taking the consultation, taking the management, taking the time. All right?
Okay. Thank you.
Okay. All right. This is in terms of this case. I'm going to answer all of your questions. Please write down them or just keep them at the end. I'm going to answer them. All right. So let's move on to the next case. Who is next, doctors? Sorry, Dr. Soha. Are you here, Dr. Soha?
Yes, doctor.
All right. How are you, Dr. Soha?
Alhamdulillah. How are you, doctor?
I'm fine. Thank you. Thank you, darling. All right. Let's move on to the next case. Dr. Riham, just answer my questions in the chat box. Did anyone from your study partners, I'm not sure if you are a subscriber in my course or not, but did anyone from the study partners commented on your thoughts about the data gathering or not? And did you have an idea before about how to gather the data in the history in the history based cases and in the test results? What is the difference in the data gathering or not? Did you have an idea about this or not? Okay, just write in the chat box. Yeah, read your question, Dr. Soha, please. Do you hear the bell, doctors? The 2 minutes and the end of the station. Do you hear it or not?
No.
You don't hear it.
Mm.
Okay, just let me try this. Do you hear that?
2 week.
2 weeks. Okay. No worries. Begin.
So Higazi GMC number 123456. Hello, I'm Dr. Higazi. I'm one of the doctors in the GP. Are you Mr. Alex Free?
Yes, doctor.
Could you please confirm your age for me?
I'm 70 years old.
And how would you like me to address you today?
Alex is fine.
Okay. Well, Alex, I can see from my notes that you are having a cough. Can you tell me more about that?
Yes, I've been having cough for 2 months now, doctor, and it's getting worse.
Mhm.
I took too many medications for it, but it's not helping.
Okay. And is it a dry cough or with phlegm?
No, I would say sometimes it's dry, sometimes it's with phlegm, clear phlegm.
Mm-hmm. And is this cough maybe related to the morning or the night?
No, it's not related to a specific time.
Okay. And can you think of anything that has triggered that cough?
No,
Mm-hmm.
nothing in my mind.
Okay. And do you have any chest pain with that?
No, I don't have pain.
Any dizziness?
No,
Any heart racing?
no,
Any leg pain?
no,
Okay. And do you think that this cough has improved with anything rather than the medications, maybe a certain position or anything?
no, doctor.
Okay. Can you tell me, Alex, has this happened before?
No, like this cough, no, before that, no.
Okay. And do you think that you have lost any recent weight?
Well, I would say yes, doctor. I'm losing weight. I didn't weigh myself, but I think that the clothes are getting bigger.
Mhm. Okay. And do you have any fever?
No,
Okay. Any lumps or bumps around your body?
no,
Okay. Have you lost your appetite or anything?
uh, yes, my appetite is not good nowadays. Yeah,
Okay, it's okay. Do you have any medical conditions, Alex?
no,
And are you on any medications?
no,
Okay. And have you recently traveled abroad?
no,
Okay. And do you have any family history of any lung problems?
not that I'm aware of, doctor.
Okay. And do you smoke, Alex?
Yes, I do smoke. Yeah, I smoke
No.
cigarettes.
Okay, and how long have you been smoking for?
Oh, since I was teenage, doctor.
Okay, and how many cigarettes per day?
Oh, 2 packs.
Okay, well, sure to address this shortly in our management, okay?
Okay.
And do you drink alcohol?
No.
Okay. What do you do? What did you used to do when you did,
Well, I was working as a carpenter.
mhm. And were you exposed to anything, any fumes, anything like that?
Yeah.
Okay. And can you tell me, Alex, you've been coughing now for a few months. How has this impacted you?
Well, it's affecting my sleeping, doctor. I don't sleep very well because of the cough.
Mhm.
I'm trying to take the medications, but not helping at all.
Yeah, I understand how hard this is. I'll make sure that I will try my best to help you out, okay?
Okay.
Okay. And do you have anyone to support you, Alex?
Yes, I have my family around, everything,
Okay,
good.
that's good.
Yeah.
And do you have any idea what might be happening here?
Well, I'm concerned, doctor, to be honest.
Mm-hmm. Yeah, can you share what is concerning you?
Is it cancer, doctor?
Mm-hmm. I'm sorry that you feel that way, Alex. Can you tell me why exactly do you think that?
Well, it's for a long time now, and I'm losing weight. Sometimes there's blood in when I cough. I'm scared. I'm
Mm-hmm.
scared, doctor.
I really understand how worried you are, and I will try to help you out, Alex. Is that fine?
Okay, doctor.
Okay. Thank you for answering my question. I will now start to examine you, Alex. I will do a general observation and I will then listen to your chest. If you have phlegm now, I might ask for a culture. And I will order some basic bloods. Is that okay with you? And a chest
Okay.
X-ray as well.
Mhm.
Mhm.
This one.
Okay. Thank you for letting me examine you, Alex. Um, Now, Alex, I know that you are concerned about cancer.
2 minutes.
Okay. For regarding your history and your examination, I'm afraid what you're having could be cancer, Alex. I'm really sorry about that. I didn't say that you're not having it right now. Just still needs more investigations to be done, but it's a possibility that we need to be ruling out.
I was scared about that. I was thinking about that.
It's understandable. I know that you have a lot of questions and it's overwhelming to you right now, but I'm here to help you out and um, we can provide you with all the help that you need.
Well, what will happen now, doctor?
I will refer you urgently to the specialist, and you should expect a letter within the next 2 weeks. If you don't receive it, just contact us back. They will do further investigation and they will do some a biopsy just to make sure that this is not something serious. So, would you like to
What do
know?
you mean by biopsy, doctor? Is it sample or?
Yeah, exactly. Biopsy is a sample from the tissues that is affected. And then this is the only thing that they can do to have a definitive diagnosis.
So what is the outcome of?
Well, it could be either something, just an inflammation, and it could be something like mesothelioma, which is a type of a cancer that affects the lungs after smoking and after exposure to fumes.
Time's up. All right. Okay, thank you, Dr. Soha. How do you feel?
I don't know.
My lovely course subscriber.
Thank you, doctor. You as well.
Okay. Let's see the other doctors. How do you feel, doctors, about Dr. Soha's performance? Okay, like it? All right. Good, very good, bad, very bad, very good. Yeah, well done. You did it very well, Dr. Soha. I don't have any thing to add, to be honest, or any comment. The only thing that I can comment on is asking about alcohol. Not very, relevant to the case. Other than that, very good. Data gathering, everything were asked. Interpersonal skills, very, very good. And the management as well. You reached the management. Was having only one question to ask, which is, what is the prognosis of this type of cancer? What would you say?
It has a poor prognosis.
So unfortunately, it has poor prognosis, but let's think about what could be the cause first, and then we can think about the prognosis. Okay, so this to give support and to answer sensitively to the patient. Okay, all right. Well done, very, very well done. I think you've covered it all. If I just give a where is the long, where is the long? Yeah. Notes. Quickly for the doctors. Yeah, it's here. Okay, doctors. Dr. Soha has covered it all in terms of the present history, the past history, the personal smoking is important. Sleeping, you can ask, but I told you in the effect of this problem in mind. And then examination, phlegm test, X-ray, you can add ECG. If you think that this is something related to the heart, how to give the diagnosis, what we can do to the patient, and everything. Okay, so yes, good. Let's do the next case. Well done, Dr. Soham. Dr. Ammar Yassin. Dr. Ammar Yassin. So you have two possibilities, doctors, in cancer lung. You might have a well-defined circle in the X-ray. This is suggestive of cancer. Okay, all right, well-defined patch in the lung. Okay, mesothelioma. Can you see the hyperlucency around the lungs here and here? This is suggestive of mesothelioma. You can find fibrosis in the lungs, specifically the affected lung. Okay. in the data gathering as well, when you ask him about the job, if he's carpenter or any job that requires exposure to fumes, then you think about mesothelioma. Okay. If he's an office worker, he was not exposed to fumes with patchy lesion in the lung, then you can think about lung cancer itself, small cell lung cancer, uh, uh, as far as I remember the name. Okay. All right. Dr. Ammar Yassin, are you here? Ammar Yassin? Not here. Dr. Nihad? Dr. Nihad, 17th of October. Okay. Dr. Hamza and Dr. Parcella, are you here? Dr. Hamza and Dr. Parcella?
Hello.
Hello?
Yeah, I can hear you, Dr. Sahar. I can do now.
Okay, Dr. Parcella, let's go to the next case. All right. Read the question, please.
Okay.
Ready?
Yeah, I'm ready.
Okay. Start.
Good afternoon. I'm Dr. Zarifi, one of the doctor in this GP clinic. Are you Lina White?
Yes, doctor.
May I confirm your age, please?
I'm 45 years old, doctor.
How can I call you?
Lina is fine.
Okay, nice to see you, Lina. How can I help you today?
Well, doctor, I do have some concerns about one of the diseases.
Could you tell me a little bit more about that, Lina?
Well, my mother has been diagnosed with Huntington's disease, and they told us it's it runs in families, and I'm concerned. I'm very concerned that I might get it, doctor.
Yeah, that must be concerning, Lina. I can see that you're worried. Yeah, I will talk about all that, but let me ask you some question first. Is that okay with you, Lina?
Okay, doctor.
How is your mom doing now, Lina?
Well, she's okay. They diagnosed her with that, and they give her the support and all of the treatment that she can get, and hopefully everything will be okay.
Yeah, I hope so. And may I know about your mother age, Lina? At what age she is diagnosed?
Well, my mother is 65 now.
Okay, and does she have any symptoms?
Yes, doctor, she was having started to have dementia. She's forgetting everything. She has depression. She has some, different movements, involuntary movements, many things, and we get a long time to confirm this diagnosis.
Yeah, that must be difficult. Okay, Lina, may I ask, do you have any siblings?
Yes, I do have two siblings. Yeah.
And how are they at the moment?
They are okay.
Okay, and how about you? Do you have any, like, recently any mood swings?
No, no, doctor.
Any problem with concentration?
No,
Problem with walking?
no.
Okay. May I know, Lina, that do you have any children on your own?
I do have, yes, 2 children. Yeah.
Okay. And may I know, Lina, do you have any medical condition I should be aware of?
Yes, I do have hypertension and I'm taking amlodipine.
Okay. And is it well controlled?
Yes.
And apart from that, do you take any regular medication?
No.
And how is your lifestyle? Like, do you eat healthy?
Yeah, I'm eating healthy. Yeah, trying to be a healthy woman.
Great. And okay, Lina, so before I discuss anything, I want to know how much do you know about Huntington disease?
Well, I don't know very much, doctor. It's the only thing that I can remember from what they said, it runs in families.
Yeah. And have you done any research about that?
No, I didn't have any researches. No.
Okay. Let me now. I will take pen and I will draw for you. Okay. So Huntington disease is a as you mentioned that it runs in family. It's a genetic condition. It's it's an autosomal dominant. What that means? It means that like your mother has the disease. Okay, if I write it down, H, and with a normal one, and your father is normal. So if one of the family has the disease, so you have the chance of getting the disease. Unfortunately, 50% have each of the child has having the disease. Are you following me?
Do you mean that I might get this disease, right?
Unfortunately, Lina, but if you want, then we can test you. Okay, everyone in the family, every of the sibling have 50% chance of getting this one, Lina.
Even if I don't have symptoms, doctor, I don't have any symptoms.
At the moment, you do not have symptoms and you do not know that you have got it because you have 50, as I mentioned, 50% of chances. But some people they will get the symptoms in later stage in life. It's up to you that if you want to get, we can send you to the genetic counseling and you can talk about that one. Option is absolutely up to you, Lina, if you want to get tested.
Okay, so what tests that you are going to do, doctor?
So at the moment, we can send you to the genetic counseling, and then they will do some genetic testing. And once, according to the test result, they will tell you. You mentioned if
Documentary.
okay, if you didn't have the disease, let me tell you, Lina, there is your children will not have any disease, okay? Because when you do not have it, so there is no chance that your children will get it, okay? So let me tell you about that. And about you said that you have hypertension. It's very important to have. You also say that you're having healthy lifestyle. That's good. Keep on doing that one. And according to the test that they are doing in the genetic counseling, they will talk to you that because this depends on the test result. Do you have any question at this point, Lina?
Yes, you told me that my children, if I have the abnormal gene, then my children might get this problem, right?
If you have it, Lina, then there is also 50% of chance that you can transfer this to your child, that you have transferred. But in the future, if you want to have children, there is pre-implantation genetic disease that they will talk to you that they about that one. If you have, then they will talk to you that you cannot transfer in the future if you have children.
Okay, so what kind of help that you can help me, doctor? What kind of support that you can help me in confirming and doing?
Clearly now.
Sorry? Hello? Time is up. So, Dr. Marcella, can you hear
There are
me?
lots of support available now, like I think it's net connection.
Hello?
So
Can
there
you
are
hear
lots
me?
of help. Yeah, I can hear you, Dr. Sahar. Hello.
Can you hear me clearly, Dr. Marcella?
Yeah, Dr. Sahar, I can hear you. Can you hear me?
Yes, now I can hear you. There was a problem
Yeah,
in
I
the
can hear you,
internet.
Dr. Sahar.
Okay, so the time is up. So how do you feel?
Yeah, I couldn't hear you also before. I don't do it. I don't know. You tell me, Dr. Sahar.
All right, no worries. Okay, so you can hear me clearly, doctors, right? So the problem is in the side of Dr. Marcella, right?
Yeah, I can hear you now, Dr. Sahar.
Okay, I mean the other doctors. Can you hear me clearly, doctors? Just say yes or no. Okay, so the problem is in Dr. Marcella's side. Okay, all right. Okay, Dr. Marcella. So, in terms of the data gathering in this case, I think you've done it well, okay? You asked the relevant questions. You were to the point in terms of the data gathering, okay? What is concerning me is the management part, the explanation part. It was good, but you could have done it better. Okay? How we can do it better? Firstly, you jumped to the inheritance of Huntington's disease without explaining what is Huntington's disease.
I could have said that it affects the brain movement and yeah.
Yeah, okay. So it's a condition that can affect the neurology, the nerves in the body, and the mental health. Okay, you can say that. All right. So the nerves in the body and the mental health. The patient can have some abnormal movements. The patient can have depression or mood swings or affection of his mood. All right, with some other problems as well. It's a disabling disease and it runs in families. I can see how you are concerned about that. It must be worrying. Do you want to know what are the chances of having the disease or not? Then you explain. Okay? So
Okay.
explain the disease first, all right?
Yeah.
And then explain the inheritance. How to explain the inheritance? So if I can show you the mind map, the visual memory always enhancing the studying. Huntington's disease. Can you see the map?
Yeah.
So this is the data gathering, what you need to ask. I'm going to let's talk about it first. Okay, so you recap. I can see you have some concerns, and then you explore. When did you get to know that your mother has this disease? What are the parents' symptoms? I mean, what are the symptoms as you asked of your mother? What are your main worries? All right. Any medicals that you have, any medications, then the psychosocial part, how is the family, is they coping or not? Do you need any psychological support? Do you need any help? Your mother is having all of the help or the support or not? And how have you been affected by that? And then ideas, concerns, and expectations. You don't need to examine the patient in this case. No need. Then the explanation. How much do you know about the disease? Explain the disease, and then you start your explanation. You most probably might be provided by a pen and paper. Okay, so you take the pen, you take the paper, and explain the inheritance. Okay, you start first by telling her it's a genetic disease, runs in families, and everyone take the gene, pairs of gene, one from the mother and one from the father. Okay, and this disease can be inherited in a way called autosomal dominant. What does that mean? Autosomal. You explain the basics. Okay, we have explained the basics. Then autosomal. What is the meaning of autosomal? Autosomal means that males and females can be affected. All right. Then what is dominant? To have the disease, you have to take one abnormal gene from the parents.
Yeah.
Okay, this is dominant. And then you explain by the pen and paper if we have if you have this the mother and the father and pairs of genes, one is normal and one is abnormal, and what let's say the other parent is normal. Okay, then can you see that?
Yeah.
Okay, then mix and match, and then you tell her, as you can see, 50%, you have 50% to get the abnormal gene if your mother has the abnormal gene. Okay, let's say your mother has the abnormal gene, and draw the one normal and one abnormal. Let's say your father is normal, okay, and then mix and match the genes. Okay, you will find that 50% of the siblings, or the half of the siblings can have the disease. This means that you have 50% to have the disease. You might be normal, you might be not. You don't have symptoms because the disease can appear late in late stages or in later on in the age. Okay, so you have 50% to have the disease. To be able to support you, you tell her the screening test and then genetic counseling. They will give you an idea and the details about the chances and if you have the disease or not, what to do after that, and what are the kind of support that they can provide you with. All right.
Yeah.
So this is how to explain. All right. So you didn't explain what is Huntington's disease. All right. You explained to me the autosomal dominance in a good way, but it could be better, as we explained. All right. The last thing, which is, please give the patient time to talk. You were talking. I wanted to ask some questions in the middle. I didn't have this chance because you were talking without pauses. Just say, okay, after explaining, okay, is that clear? Do you have any questions? You asked me, do you have any questions? But very, very, very late when you told me everything.
Yeah.
All right. So please give pauses to the patient. I can remember Dr. Barcella, okay, in your performance. In the management, you were talking a lot. It's getting better, much more better, but you still have this problem. Okay.
Right.
All right. So pieces and chunks. Give the patient pieces and chunks. And then between each piece, check.
Yeah, the understanding of the patient, right? That's better.
Okay? So this is the main thing in your performance. Okay? So please focus on arranging your thoughts while you are explaining to the patient. Give the patient time to ask and give time for the patient to understand. Okay? This is the main thing. This is the main thing. If you did that, you would have done the case perfectly.
Okay.
Okay? All right, Dr. Priscilla. If I would give you marks in data gathering, to be honest, 4. Management skills, I would say 2, between 2 and 1. 2, okay? Interpersonal skills, 2 as well, because you didn't explain in a good way the Huntington's. You didn't give time to the patient to ask questions. All right?
Okay.
Okay. So this is in terms of marks. 4, 1, 2.
Okay.
1 is better. Just for you to give you, push to practice more on explaining things. Yeah. All right. Okay. So any question, Dr. Marcella?
No, that was clear, Dr. Sir. Thank you.
Okay. You're doing very well. Okay.
Thank you.
I can remember the first time you did a case with me.
It was
But no. Now, much more better. Keep it up.
Thank you.
All right. Okay. Dr. Hamza is here.
He will come later, Dr. Sahel.
All right. Let's see if we do the other cases with the others. Dr. Muaz. Are you here, Dr. Muaz?
Yes, I'm here.
All right. So
All
are
right.
you ready?
Okay.
All right. Before doing the case with Dr. Muaz, I just need from you, please, doctors, to participate in this poll, please. Okay. Feedback about the session until now. All right. How did you find it? Are you satisfied or not? What did you like in the session until now? Okay. And if you have any suggestions, please write down. Feedback is very important. It gives us an idea about how the session was and what are the suggestions from everyone to improve more in in conducting the session and the content as well. All right. So please do not underestimate giving your feedback, please. All right. When you buy anything, the first thing that you look at is the feedback from the customers. All right. So don't underestimate the feedback. Give your feedback, please. And I will leave it until the end of the session. All right. Okay. Dr. Muaz, let's get started.
Okay.
Just read your question, please. And if you want a break after Dr. Muaz, after doing the case with Dr. Muaz, please write down in the box. Okay?
Okay.
Start.
Okay. I'm Aziz Shini, GMC number 1234. Shall I proceed?
Yes.
Hello?
Hello.
Hello, Mrs. Thompson. This is Dr. Shifini, one of the doctors in the GB here. Um, how are you doing today?
I'm fine, doctor.
Okay, please, can you confirm your name and your age for me, please?
I'm 35.
Okay. Uh, uh, what shall I address you today?
You can say Maria. Maria is fine.
Okay, Maria. Um, so from my notes, I see that you have been diagnosed with depression for 8 weeks. Am I right?
Yes, doctor. Been having
Okay.
depression and
And what the doctors was told you for management?
they started me on talking therapy. To be honest, doctor,
Yeah,
this talking therapy is useless. It's not helping me at all. I'm still having this low energy. I'm not concentrating
yeah.
very well. I lost interest in
Mhm.
everything.
Well,
It's
well,
not helping at all.
I'm so sorry that you had to go through this. So before we start, can I ask you some question? It would be all right.
Okay.
So, do you first for how long do you have the CBT sessions?
For 6 weeks now, doctor.
Okay. Did you attend them all or miss any sessions?
I attended all of the sessions, and
Okay.
there are two sessions left, and I don't think that they are going to help. I'm still the same, no improvement at all.
So that's so sorry. I'm so sorry to hear this. So, uh, first of all, what was the reasons that you come for the doctors at the first time?
Well, I was divorced from my husband
Yeah.
4 months ago, and I'm
Well,
not coping with that.
well. So, uh, how is your mood on a scale from 1 to 10? One is the less, and 10 is the best mood. How you scale it?
It's very bad, doctor. I can't say 1 or 2.
So how is your sleep?
I don't sleep very well.
What about appetite?
I don't have any appetite.
And
I don't eat.
so. And what about your concentration? Do you feel that you don't? You feel that you're tired all the day?
I'm not concentrating. I lost energy. I don't have energy to do anything.
Uh, and by the way, do you have any thoughts of harming yourself?
No, doctor.
Okay, that's reassuring. So, by any chance, do you experience that you hear any sounds and with no one around you?
No,
Okay. So, apart from depression, do you have any other medical problems?
no, just depression.
Do you have any medications?
I'm not taking medications, no.
Okay. Uh, and do you smoke?
Yes, I smoke.
How many cigarettes a day?
A lot, doctor. I don't count.
For how long?
For a long time.
Okay. Do you drink alcohol?
Yes, I'm drinking a lot.
And how, what are you doing for life?
Well, I'm a teacher and I don't have the energy to work at all.
Yeah. How this and I can see that the depression is affecting your life. And
Yes.
yes, okay. Um, so how do you have any particular concern?
Yes, I just need to start any medication. This CBT is not helping at all.
Yes, it's a valid concern. And so do you your expectations from this session is you to have antidepressant. Am I right?
Yes.
Okay. So can I just go for a fast physical examination or fast physical check?
Okay. Observations are normal.
Okay, normal. Okay. Uh, so uh, I can see that the CBT, as you say, that is not working. Is not working good with you. And so we can start medication, what's called antidepressant medications, uh, and we can start with sertraline. Uh, did you hear about it before?
Yes, doctor, I did hear about it before. So,
Okay.
for how long should I take it?
You will take it for 6 months after it, you start to feel better, and its effect started within 2 or 3 weeks, and the full effect will comes after 1 month. Is this will be okay with you?
So, will I go again to my normal life, doctor?
Uh, as I told you that the effect started with 2 to 3 weeks.
Time's up.
Is this okay? Okay.
Okay, thank you, Dr. Muaz. How
Okay.
do you feel?
Awful.
Why do you feel that?
I know that my exam still I have time, and I just started to practice 2 weeks ago,
Mm,
uh, and I'm trying.
yeah. Okay. So
Okay.
this was my question. I was aiming to ask, did you start practicing or not? Okay. So
Uh,
you are just starting practicing for two
yeah.
weeks. So how many days you practice?
I think day by day.
Or every other day, you mean?
Hmm. Yeah.
Okay.
The other day.
All right. Okay. And how many um hours or how
Just
many cases that you practice?
total maybe uh, just 10 or 12 cases.
Okay. All right. So,
Okay.
with a stable partner or you are changing the partners?
Changing.
Changing the partners. Okay. All right. So, it's good that you started, okay, practicing.
Okay.
All
Thank
right.
you.
And this is normal at the start of the
Okay.
practice. Um, it 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 could have been better if you start practicing earlier than that because your exam is just 1 month and 2 weeks, as far as I remember.
No, at 28 November.
Okay, 28th of November.
Yeah,
Okay, not October.
not October, November.
Okay, November. All right, so you have time. Okay, I
Yeah,
thought it's October. All right, just give me a second.
November.
All right, good,
Okay.
good, good, good. So that's good. That's plenty of time. All right.
Okay.
Yeah,
Yeah.
good. So at the very start of your practicing, this is normal, and it's good, to be
Thank
honest.
you.
Okay.
Okay, thank
Thinking
you.
about
Thank you.
so the problem is you are thinking about the next question. What should I
Yeah.
ask? How should I answer? And what is my comment when I see the patient is feeling low, losing interest in everything? How to reassure? How to give support? All of these are missing, but it's normal. Okay, it's
Okay.
normal at the start. And you did a psychiatry case. Psychiatry is one of the tricky cases. But
Mm.
yes, it's a very good start, to be honest. Okay.
Okay, thank you. Thank you.
All right. So if I would say something about your performance or anything that you can consider in your practice to improve, with the time you will find yourself that you are asking the questions quickly. Okay, so you
Okay.
took too much time to ask the next question. Okay.
Okay.
So you take time in asking the questions, and trying to give support to the patient, how to empathize and sympathize, and how to comment on the patient's feelings. Okay, so always say,
Yeah.
I can see. Okay,
Yeah.
all right.
Okay.
As a start, you say, I can see how you are feeling down. I can see that you are looking down. I can see that it is
Yeah.
hard on you. Okay, so I
Okay.
can see
Okay.
how it is hard. I can see how it is difficult. I can see that it is too much. Okay, so
Okay.
always acknowledge. How to acknowledge? I can see. All right.
Okay. All
Yeah.
right.
If she is looking down, I can see that you are looking down. I can see how you are feeling about this. All right. So always
Okay.
acknowledge. Yeah.
Okay.
If she is not coping, I'm sorry. I'm really sorry to hear that. I'm really
Okay.
sorry to hear that.
Okay.
It must be difficult. It must be
Yeah.
hard. It must be too much. Okay?
Okay.
Um,
Okay.
all right. So this is
All right.
how to improve your practice. Yeah.
Okay.
Quickly asking the questions and sympathy and empathy in the cases. All right.
Okay. All
These
right.
are the two things that you have to think about or to consider to improve in your practice. All right, Dr. Muaz?
All right, Dr. Saad. Thank you. Thank you very
Thank you,
much.
Dr. Muaz. Thank you so much. Thank you. Thank you for your participation.
Okay.
I'm happy that we've done the case so we can point out what is the problem and how to improve. Yeah.
Okay.
Okay. So in this case, the patient is not coping, the CBT is not working. You can see here the mind map of psychiatry. Ooh. Um, where is CBT? CBT 56. Okay, so can you see that? This is the mind map of the psychiatry. A patient who is depressed on CBT. The CBT is not working. The patients still have the problem. So you ask, since when you have CBT, what symptoms you are having, Are you compliant on the CBT sessions, as Dr. Muaz asked? Do you take the sessions in groups or alone? How is the counselor with you? Maybe there is a problem in the counseling session itself. Okay, so you can address it in the management. Is there any specific thing that you don't want it? If he doesn't want it, if he tells you, doctor, I don't want to take the CBT anymore. All right. So it depends on the concern of the patient. Okay. This mind map is general. It has general questions. You can select the questions based on the context. In this case that we have discussed with I've performed with Dr. Muad, the patient is thinking that CBT is useless. He didn't tell you, I don't want to take the CBT. Okay, so it depends on the context. All right. You can ask, why do you think that it's not helpful? Why do you think it's not it's useless? All right. After you explore, you can ask anything else. Do you still feel the symptoms? Do you have, if he didn't tell you, what are the symptoms from the start? Okay. Do you still feel loss of interest, feeling guilty? Do you feel like life not worth living? Okay. And then Mafia R. It's a mnemonic for any psychiatry case, mood and medical conditions, family support and friends, finance and forensic, impact of this problem on life, insight. Does the patient need help or not? Or does the patient feel like he needs the help? A for alcohol. Alcohol brings drugs. R for red flags. What are the red flags in depression? Sleeping and eating. Okay, these are the red flags. It's here in this specific case. Suicide and children. Sleeping and eating, you can ask also. Okay, sleeping and eating, suicide. Any children at home? You missed that, Dr. Muaz. Okay, the patient is 35. Maybe she does have children. She's not coping with them. So you involve the social services. Okay, if she is looking after them alone. Okay, if she's not coping, looking after her children, you can, because she is 35, she's young. Her children may be young, most probably young if she has children. Okay. Then ICE, ideas, concerns, and expectations. Then examine the patient. No investigation needs here. Nothing is written. Then you can give the diagnosis, how to give it to the patient, and what is your management. The CBT is not working. The patient still has the problem, loss of interest, loss of concentration, loss of energy, feeling low, not coping, everything is bad. So the CBT is not working with him. So you start the medication. Okay, you can start by sertraline, as Dr. Muaz said. He is drinking alcohol. You didn't address that, Dr. Muaz. All right. You tell him you drink alcohol. Alcohol is, you didn't even ask me how much do you drink. Okay, so you have to ask how much do you drink to check if he's alcoholic or, you know, is he exceeding the limit of alcohol or not? Okay, so if he, yes, in my case, I was aiming to tell you, yes, I'm drinking a lot. Bottle of wine every day. Okay, so you address that. You tell me alcohol is not very good with depression. It affects the depression badly. It's very important to cut it down. We can help you by you know, many options here if you would like to hear about them. Okay, so start the medication. Talk about the alcohol. This is your aim in the management. Okay. And if you have time, you can talk about, you know, his role in the treatment. Okay, like thinking positive, being more sociable, try to practice some hobbies, healthy lifestyle. Okay, so you can talk about that if you have time. But the main things, the main 2 points in the management in this specific case that we have performed, starting the medication, talking about alcohol, and answering the patient's concerns. The patient will tell you, doctor, for how long should I take the medication? When can I see the difference? Okay, will my life come back again, doctor, or not? Is there any side effect from the medication or not? Okay, so all of these are general questions that the patient can ask, so you can answer his questions. And again, doctors, the management is not reciting everything to the patient. It's a consultation, ping pong consultation. All right? You tell him, we can start the medication. Do you want me to talk about the medication? Then you talk about the medication. Okay? You can give a frame first. Well, okay, as the CBT is not working, we can start the medications. And there's another thing which is very important is the alcohol issue or the alcohol that you drink. We can talk about all of that in details. So which one would you like to talk about first? Okay, then the patient will tell you, medication, doctor. Can you please tell me what medication that you are going to give me? Will my life come back again? All right, then you answer the questions. Okay, some doctors, they preoccupied by the questions. They know from different notes that the patient will ask this question, this question, this question, and this question. So once he enters the cubicle and reach the management, he tells everything about the medication without the patient ask. Okay, this is reciting. Okay, this is not a consultation. Okay, doctors? All right. So I think we have covered the case. We can get a break. Do you want a break, doctors? 5 minutes, 10 minutes, if you would like. Yes or no? 10 minutes, please. Okay, Dr. Soha. The others? Break? Okay. All right. We can take a break. All right. Yes. Okay. 10 minutes. Okay. All right. So before you go to the break, please submit your answers in the feedback. Please, please, please. Okay. And for your questions, I'm going to answer them at the end of the session. All right. Okay. Have a nice break. Okay. So we have done with Dr. Muaz. Start.
Arwa Ali, GMC number 123456. May I proceed?
Yeah.
Hello, my name is Dr. Ali. I'm one of the doctors in the outpatient clinic. Am I talking to Mr. Adamswell?
Yes, doctor.
Can I confirm your age?
I'm 50 years old.
Okay, and would you like me to call you for today?
Adam is fine.
Okay, Adam, nice to see you. I can see you from my notes, Adam. You are here for a follow-up. Am I right?
Yes, I'm in my follow-up after having a chest infection, doctor.
Okay. I'm glad that you are attending your follow-up, Adam.
Thank you.
Okay, Adam, can you tell me, do you have any complaint now and everything is going on well?
Everything is okay. I don't have any symptoms. The cough is gone. Everything is okay.
Okay, have to hear that. Do you have any chest pain
No,
Any fever?
no,
Any shortness of breath?
no.
Okay, okay. Okay, and you finish your antibiotics.
Yes.
Okay. Do you take any medication now, Adam?
No, no, I don't take any medications. No.
Okay. Do you have any medical condition should be aware of?
No.
Okay. Okay, Adam. Do you have any concern?
No, it's just, it's, the follow-up. I don't have any concerns, to be honest. No.
Okay, Adam. And do you smoke?
Yes, I do smoke. Smoke cigarettes. Yeah.
Yes. How many?
Um, 1 pack of cigarettes every day for a long time now.
Okay, I will address that by the end of the consultation. And do you drink alcohol?
No.
Okay, and how about your lifestyle? Do you think you are following healthy lifestyle regarding exercise and diet?
Yes.
Okay, and how all of that is affecting you, the cough and the condition you was in?
Well, it didn't affect me, to be honest. I was just worried about having anything serious in my chest, but thankfully they treated it, and I'm fine now.
Yeah, okay, that is very good. And do you have any idea what the cause of the cough?
Yeah, they told me it's a chest infection.
Okay, and do you have any expectation for the consultation today?
No.
Okay. Am I examine your chest and take general physical observation of you, Adam, if you don't mind?
All right, examinations are normal.
Okay, thank you for letting me examine you. Actually, Adam, what happened? You came to the hospital 6 weeks ago with cough, and we gave you an antibiotic.
Yeah.
And you continue. You take all of the medication as prescribed.
Yeah.
Okay. Adam, there's some news I want to tell to you. Unfortunately, Adam, we prescribe an antibiotic regarding pneumonia. It is a chest infection,
Okay.
and later we discovered that you had given a medication for a wrong X-ray. It was not for you.
What do you mean by this, doctor?
Actually, from the start, we didn't have to give you this medication. I'm really sorry about what happened.
So I didn't get what you mean. So I was not having chest infection, do you mean that? And you gave me the antibiotic unnecessarily?
Yes, actually, you take a medication for unnecessary, as you know, as you understand. Yes, and that is was a mistake.
How did you know that it's not my X-ray?
Actually, we took the other X-ray, and we review it again,
Okay.
and we found that your X-ray, thankfully, it was normal.
Okay.
Yes, and you was treated based on another patient X-ray. I'm really sorry about what happened, Adam. This not your mistake, and
Shouldn't the X-ray be labeled?
yes, I don't know exactly what happened, and we will do all of the investigation required now. We will investigate about this, and we will fill an incident form.
2 minutes remaining.
Yes, thankfully your condition now is stable, and you didn't experience any side effect of the medication, and that is the good news now. But I'm really sorry about what happened to you. Are you following me, Adam?
I'm following you. So what happened to this patient then? If you
The
gave
other,
me the medication wrongly, so what happened to the other one?
yes, we will review him again, and don't need to be worried about him. That is very kind of you. We will look after him, and we'll see what we have to give him. But regarding you, Adam, we will fill the incident form, and we will investigate about what happened to make sure this will not happen again.
I can't accept that.
Yes, I can see you are not happy about what happened, and that is totally understandable.
I had this bad diarrhea when I took the antibiotic. I took the antibiotic unnecessarily in the hospital, and then I get side effect from it, and then you are telling me sorry? So what is there any problem then? I will have it. I will have any problem after that from the antibiotic?
Do you have diarrhea now?
No, I don't have the diarrhea. It went away. But is there any complication from taking necessary antibiotic?
Actually, thankfully, we don't have anything now. But usually, don't take. Usually, taking unnecessary antibiotic is not a good things to happen. But we will follow you up. If you experience anything, you can come back at any time.
Thanks. Okay. Thank you, Dr. Arwa. How do you feel?
I couldn't remember the structure of medical error. I'm just talking. I don't follow any structure.
Okay, no worries. It's fine. It's fine. Okay. So, well, if I talk about the data gathering, so in this case, what's your task? Talk to the patient, explain the medical error, and address his concerns. صح?
Yes.
Right?
Yes.
So your task should be explaining the medical error and address his own concerns. Yeah.
Mm-hmm.
You did the task, but partially. Your explanation was not very right, and what was vague. Okay.
Okay.
I didn't understand what is the mistake exactly.
Okay.
All right. So that's why I asked you, do you mean that I took the antibiotic unnecessarily and it was not my X-ray? Okay. So I was just asking to understand what was the situation. You didn't explain the situation clearly. Okay.
Okay.
So this is in terms of the task, and this will affect your marks in the management. Okay.
Okay.
This is the first thing. Secondly, the type of this case is explaining an error to the patient, right?
Mm-hmm.
Okay. In the data gathering, do you think asking about alcohol and smoking is important at all in this case?
I think maybe affecting the cough.
Did you do that?
No, and I'm not talking about the smoking at the end.
You didn't talk about the smoking,
Yes.
and you will not have time to talk about it. And it is not your issue.
Mm-hmm.
Okay? If you have time and you would like to talk about the smoking, then you can bring it in the management. No need to ask about it in the history taking at all. Okay?
Okay. Okay.
So alcohol and smoking in this case is not important. You don't need. You just ask about what happened. How is he now? Does he have any cough, any symptoms at all, any side effect from the antibiotic, and medical conditions, medications, and then you move on to explaining the medical error. Okay?
Psychosocial is not necessary as well.
Sorry?
Psychosocial.
Yes, you can ask. Yes, you can ask ICE and psychosocial here in the case. It's not a problem. Okay, yeah, of course. Okay. How have you been affected by this admission? How have you been affected by the symptom itself? This is a very good question. Okay. But I'm telling you about the smoking and alcohol. They are not important. Okay.
Okay.
Then in the management, it was the main problem. I mean, the explanation of the situation itself. Okay. You were vague. You were not to the point. You were hesitant. Okay. So avoid the hesitancy in your voice. Stuttering in the voice. Yeah. Be confident and narrate what happened. All right. You tell him, well, Mr. X, as you know, that we gave you an antibiotic because they told you that you have a chest infection, right? Right. Okay. Well, unfortunately, there is a mistake happened in your treatment. And give a pause. Okay. And then explain the situation. All right. You have been given antibiotic based on another patient's X-ray. Your X-ray was normal and it was mixed up with another patient who has pneumonia or has chest infection.
Okay.
Simple, short, to the point. Okay? Yeah. Then a very big sorry. After giving the pause, so 2 pauses. Unfortunately, there's a mistake happened. Pause, and then explanation, then pause. After that, you tell him, I'm really sorry for what happened. It shouldn't have happened from the start. Please accept our apology. It is a big mistake. And since this happened, we report that, we escalate that, and the hospital takes serious steps like arranging a meeting to find what happened and why did that happen and to find solutions for that. He might ask you, what solutions, doctor? Well, the mistake was mixing up the X-rays. Maybe they arrange some workshops to the doctors to be able to read the X-rays with the labels, make sure that they read the labels first. Also, we wait for the radiology department to report the X-rays before treating the patient. All of these are strategies that we can put or we can do to prevent that from happening again. Okay, so this is how to gain his trust. Yeah, once this happened, we report that, we escalate that. The hospital takes that seriously to find out why did that happen and to find solutions. Yeah, if he asks you what are the solutions, you tell him we take that as a learning point. We put that, we do that and that and that and that. Okay.
Okay.
What happened to the other patient? You told him, we will. No, not we will. We thank you for being thoughtful about the other patient, but be sure that as I'm talking to you now, the other patient, we are open to everyone. He will know about what happened, and I'm sure that they will deal with him very carefully. Okay? You are not going to tell him what happened because these are, these this is an information about other patient, and you don't know what happened to the other patient. Okay, so you tell him, to be honest, I'm not sure what happened to the other patient, but we open to everyone. We make sure that everyone knows the mistake, and everyone treated very well, correctly.
Okay.
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 Then what else? Any complications? No complications, hopefully. You took the course, no complications at all. Be sure that everything is okay with you. The good thing that you don't have any symptoms, the cough is gone, the examination is okay. So everything is thankfully good.
Okay.
Yeah. So this is how to deal in any case of medical error. All right. If the patient is still unhappy, then you tell the patient, okay, I can see that you're still unhappy.
Mm-hmm.
We can offer you, we can help you by, guiding you to the complaint department if you would like to put a complaint.
Okay.
Right? This is if he is still unhappy. If he is happy and everything is okay, then. And avoid telling the patient, are you happy with that?
Mm-hmm.
In any medical error. Okay? Because he's not happy with what happened.
Okay.
Right? So please be confident, use the structure correctly, and explain the situation clearly. Yeah?
Okay.
This
And
was the... Yeah?
regarding his question about if the antibiotic it will affect him.
Yeah, I answered you. No, as long as he took the course, the full course, no complications, hopefully.
In the long term, no
No complications, no. Okay. All right. So this is in terms of this case.
Thank you so much.
Thank you, Dr. Arwa.
Thank
More practice on medical error, please.
Okay.
Okay. Practice with yourself how to explain things clearly, not vague, for the patient to understand what is the situation exactly. Okay. This will help you to avoid avoid hesitancy. Okay. And the patient will not ask you many questions. All right. Yeah. Okay.
Okay. Thank you.
All right. So let's do the next one. Dr. Whom? Who was the doctor? I can't remember the name. Let me see. Dr. Amira.
Yes, doctor.
All right. Ready?
Yeah.
Okay. Let's do the next case. You started practicing, right?
Yeah, I did.
Okay. Good. Okay. Read the question, please.
Okay.
Start.
Hello, examiner. This is Amira Saeed, GMC number 1234. Shall I proceed? May I have a look at the ECG, please? Okay, thank you. Okay. Hello, this is Dr. Saeed, one of the doctors working here. Are you Elliot Jones?
Yes, doctor.
Okay. Can I call you Elliot for today?
All right. No worries, doctor.
Okay, thank you. Nice to meet you, Elliot. So can you confirm your age, please?
56 years old.
All right. So I understand that you did a test a few hours ago, So could you tell me more about what brought you here in the first place?
Well, I made an appointment today because I had chest pain since yesterday until now. I get, pain on and off in my chest.
Oh, I'm really sorry for that. So do you still have the pain right now?
No, I don't have pain now.
Okay, and is this the first time you had this pain?
Yeah,
Could you think of any triggers?
nothing.
Okay, so it started yesterday and it comes and goes,
Yeah.
correct?
Yeah.
All right. And did it start suddenly or gradually?
No, suddenly.
Were you doing a specific thing or just
No, I was just sitting.
okay. And could you tell me, could you point exactly where the pain?
Central here in my chest.
Okay, and does it go anywhere else?
Yeah, goes to the left shoulder and left jaw.
Okay, all right. And anything make this pain better?
No, nothing.
Okay, anything makes it worse?
No.
All right. And do you have you tried anything to relieve this pain?
I took paracetamol, but it didn't help.
And do you have any other symptoms?
No, just the pain. Some
Okay.
chest tightness as well.
And did you have any fever?
No,
Any shortness of breath?
no,
Any cough?
no,
Okay. Any recent illness?
no,
Any leg pain or swelling?
no.
Okay, all right. And regarding your general health, Elliot, do you have any medical condition?
I have high blood pressure and I'm taking amlodipine for it.
Okay, amlodipine, and you're taking it as prescribed?
Yes.
Okay, and is it controlled over the medication?
Yeah, yeah.
Okay. Do you have any allergies, Elliot?
No.
Okay. And regarding your lifestyle, do you smoke?
Yes, I do smoke. I smoke cigarettes since I was teenage.
Okay. And how much do you smoke per day?
Maybe one pack.
And do you drink alcohol?
No, just occasionally.
Okay. Do you follow a specific diet?
No.
Okay, all right. And I'm really sorry for what you're going through, Elliot. How are you coping with that, and how this pain affecting your mood in life?
Well, I'm okay. It's just was yesterday, but I'm just concerned about having it while I'm not doing anything.
Yes, I totally understand that, and I'll make sure to explain everything to you. And do you have support around you?
Yeah,
Okay, I'm really glad to hear that. Um, so thank you for answering all of my questions. Just I would like to examine you to make sure everything's fine. I'd like to check all of your observations, heart rate, breathing rate, blood pressure, temperature, and oxygen level in your body. And I would like to do heart and chest examination as well, if that's okay.
examinations
Okay.
are
Okay. So thank you for letting me examine you, Elliot. So after the information you gave me, the fact that you had this pain while doing nothing, and according to the character of this pain, I suspect that what you had from also the ECG, I suspect that you had unstable angina. Have you heard about it before?
I heard about angina, but what do you mean by unstable angina?
It's a kind of decreased blood flow to the heart. So actually, it can be
One minute.
as serious as a heart attack. It can predispose to heart attack. So
Okay.
this is kind of alarming sign, and it's a bit serious.
Okay. So what
So
are you going to do for me?
it's very advisable to go to the chest pain clinic right now, and they will offer you aspirin, and they will run some tests, some blood tests like cardiac markers, and they will do a further assessment. Is that okay with you?
All right. So am I going to be admitted in the hospital?
So just for doing some blood tests, not admission, we can keep you under observation until we run more tests to make sure it's not a heart attack. And after that, we will give you some advice regarding this condition, maybe some lifestyle modification advices. Like you told me that you smoke, and smoking is a big risk factor for developing a heart attack. So it's very advisable also to avoid smoking, and I can refer you to smoking cessation clinic as well.
Okay, doctor, but I don't want to have long time in the clinic. I can't leave my wife alone for a long time.
Okay, I understand, but how about maybe I can call her to come to the hospital?
No, doctor, she's bedridden. She can't come.
Okay, okay, that's understandable. We would just run some tests to make sure you don't have a heart attack, and we'll give you the aspirin and
Time's up. All
okay.
right, thank you, Dr. Amira. How do you feel?
I'm not sure about the diagnosis because I find it hard to interpret the ECG. So
Okay, what's the most hard thing in the ECG? Why did you find it hard?
I was trying to find if there's any ST elevation or ST depression.
There is no.
Okay, so I don't know if it's unstable or not.
Okay, so can you point any ST elevation or depression?
Uh, I don't think there is any ST elevation.
Can you see
Oh,
anything?
it's just V V2. I don't know.
This one?
No.
No, the QRS and then
Mm,
the,
mm,
the
yes.
line, no elevation.
Mm.
No elevation, no depression, and AVR always the T is depressed in AVR. So no elevation, no depression. PQRST, 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 PQRST. The large what the large
Regular.
boxes are the intervals are okay, and the large boxes are 4. Usually 4 is okay regarding the heart. Okay, this is an artifact. The patient was just moving, so it's
Yeah.
not a problem. All right, so the ECG is completely normal.
I forgot to ask an important questions. Trauma to the chest.
You can ask about trauma in the chest, it's fine. But the patient didn't have anything. He was just sitting down, okay, and he got that chest pain, which is central going to the left jaw and to the left shoulder. So it's characteristic of decreased blood supply to the heart, either angina, unstable angina, because the patient had the pain while he's sitting down. It's not an exertion angina, okay, or stable angina. It's unstable angina. It might develop, there is a chance for developing MI, as you said, okay. So it is unstable angina.
Okay. Okay.
All right. Yeah, you did right. You did right. But my concern was the
The management.
questions. No, the questions that you asked about smoking, alcohol, diet, mood, allergies. The situation is a bit urgent. Okay. So you don't need to ask about smoking and alcohol and diet here. Okay.
I asked that because smoking is a risk factor for the heart problems.
Okay. Did you use it in the management?
I said some lifestyle modifications on smoking part.
Did you talk about the lifestyle modification in the
Uh,
management?
yeah. I told him smoking is a main risk factor for developing heart attack. So, what do you think for if I referred you for smoking cessation clinic?
Okay, this is if you have time in the management. Okay, but my advice for any urgent situation, if you would like to talk about the lifestyle modification, bring it in the management only.
Mm-hmm.
Okay. What does that mean? Avoid asking about smoking, alcohol, and diet in the history taking. Okay. Move on to the examination, ideas, concerns, expectations, psychosocial, and then examine, and then explain to the patient. The patient might be refusing. The patient might ask too many questions. Okay. So the issue in this case is identifying that this is an urgent situation. This is not a cold case. It is an urgent, an emergency situation. So it is inappropriate to talk about diet, smoking, and alcohol in your data gathering. And this is not from my mind. It is from the GMC criteria. I mean the marking criteria in the website. Okay.
Okay.
All right. So this is not the issue of the case. So please avoid asking about smoking, alcohol, diet. If you have time, you can bring them in the management as you did. There are some risk factors like smoking, like blah, blah. Do you smoke? Do you drink alcohol? But after you explain to the patient that this is unstable angina and this is emergency, you have to, in real life, they send the patient to the hospital.
Okay, so I will call the ambulance and send him to the
They
hospital.
send the patient to the hospital. It's unstable angina. Okay. So from where did you have the information of the chest pain clinic?
I don't know. I just
Is it something in the NICE guidelines or in the CKS or an information from your colleague or from a note or from where?
I think I found it on the NICE guidelines regarding the yes, chest pain clinic. I think same day referral. They wrote same day referral to just chest pain clinic.
So it's in the hospital. It's a clinic in the hospital. So you will send the patient to the hospital.
Okay.
All
Okay.
right. Okay. So this is in terms of chest pain. So did you write chest pain CKS or what did you do? What did you write?
Just give me a second. I'll check it again.
Okay, no worries. Usually in the hospital there are clinics and A&E and departments. Okay. So if you are going to send the patient to the chest pain clinic, which is an emergency clinic, okay, they are going to admit the patient in the hospital. Okay. So this is unstable angina. The patient can't go home. Got me? Because you told me they will do the investigations and you're not going to be admitted. Okay. So it is highly unlikely that the patient will go home in this situation. Got me, Dr.
Yeah.
Amira? All right. So you have to clearly say to the patient, most probably they will admit you in the hospital because this is an emergency situation. You might develop a heart attack at any time. So you will need to be more closely monitored in the hospital and get the right treatment in the hospital.
Okay. All
You got
right.
me?
Yes, and how should I answer the concern of his wife?
I do understand that. I'm really sorry to hear that your wife is bedridden. So is there anyone can be with her at home? Because you might be in the hospital admitted. So try to give him options to for his wife to be looked after. Okay, got me?
Yes.
All right. So this is kind of maybe the patient might be refusing. So you have to find out why is he refusing and find a solution to his refusal. All right.
Okay.
And if he doesn't want to go to the clinic or to the hospital or being admitted in the hospital, then you have to make sure that he understands the situation. And you did that. You told me it is it is an emergency situation. You might develop blah, 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 blah. Make it clear to the patient. Okay?
Okay.
All right. So if you read something different from anyone, doctors, if you read something different from what I said, please share it now, or I will read the NICE guidelines again to, to correlate or to link it with what I'm saying. Yeah, for more understanding for you, for yourself. Okay. But unstable angina, it's a hospital case. All right. Either you send him to the chest pain clinic or any clinic, a cardiology clinic, emergency clinic. It's like loss of vision. Okay. The patient, you send him to the emergency eye clinic. Okay. So emergency eye clinic, this means that this is an emergency. We will need to keep the patient for a while in the hospital, doing investigations and confirming the diagnosis. He might be admitted. He might be kept in the hospital for the next day or the day after until the investigations finished and everything is confirmed and he's okay and safe to go home. Okay, doctors?
Okay.
Did you get what I mean, Dr. Amira?
Yes, doctor.
All right. Okay, so this is in terms of this case. All right. The only thing which was concerning me is the part of the data gathering which I mentioned. Okay. If he's refusing, please make sure that you address why he is refusing. His wife is bedridden or whatever the cause is. Maybe he doesn't like the hospitals. Maybe he had a bad experience with the hospital. One of the neighbors or one of the family members died in the hospital. So you tell him, I'm really sorry for this bad experience. I hope that your experience will be okay. Don't worry, you will be looked after, and the doctors are expert there. They will do their best to help you. Okay? So this is how to reassure the patient. And to make sure that he understands, you tell him, I know how it is. This is a bad experience for you. Hopefully everything will be okay in this hospital, but just for you to make sure that you know what's going on. You have an emergency situation. This is called unstable angina. The blood flow to your heart is blocked. When you have the pain at rest, this is an emergency. You might develop heart attack at any point. Okay, so this is how to to convince the patient and to deal with any refusal structure. Make sure that he understands, address his concerns regarding the refusal, why he's refusing, and addressing the concerns. Okay, doctors?
Okay.
All right. Any question in this case? Any question? Okay, let's move on to the last case.
Yes, doctor.
Yeah.
Doctor, I'm not sure, but is there any ST elevation in leads V2 and V3? I'm confused about that.
No, it's not elevation, darling. This is not elevation. Can you see the QRS? I can't. Where is it? Where is drawing here? Yes, draw. Yeah. Can you see here this line?
Yeah.
Just give me a second. Why it's not working? Yeah. Okay, can you see this line? It's matching
Yes.
this line. Okay, it's not an elevation. If it's an elevation, you will find it like this. Okay, the start of Q and the end of S. And can you see it's only one small box. Just give me a second, doctors.
Okay.
Sorry, doctors, I'm really sorry. It was an urgent situation.
No, doctor, no worries.
No worries. Okay, so the start of QRS is here and the end of QRS is here on the same point. Okay, and if you talk about this small elevation, no, it's not ST elevation. It's not counted as ST elevation. Okay.
So I count it as a ST elevation when it starts from early, when from at the S point.
It will be like this.
Yeah. Okay. Yes. Yeah. Got it. Yeah.
All right.
All right.
Yeah.
Thank you,
And
doctor. Thank you.
and you can find it's only one small. If you just plot a line from here to here, it's just one small square. Okay, and one small
Yes.
square is not counted as ST elevation. Okay.
Okay. All right.
When the patient has ECG normal with central crushing chest pain going to the left shoulder and jaw, this is there is something called non-ST elevation MI, right?
Yeah.
Okay, so this could be an unstable angina or non-ST elevation MI.
Yes. Yes.
Okay, so either this or this. If you would like to give a differential, yes, you can. You can say, why not? Okay, but the patient doesn't have the pain now. Okay,
Yes.
if it's ongoing pain with the normal ECG, then you can say non-ST elevation MI. All right, but the pain is coming and going. All right, this is the pain of angina, but in this case it is unstable because it's coming on rest.
Yeah.
Got it, doctors?
Yes. Yes, doctor.
Okay.
Thank you, doctor.
Thank you.
Dr. Sahar, please, regarding this station, is it considered a pass or not?
You did most of the things, okay, but it's very important to tell the patient that this is a hospital case. You might be admitted in the hospital, okay, to make his arrangements.
Okay.
All right. So yes, in terms of the management, you explained to me. You told me that it's unstable angina. You told me that you're not going to go home. Okay, at least you didn't say you can go home. Yeah. So in the management, you can take 2 or 3.
Okay.
Yeah. All right. Yeah. So let's do the next one. The last one, Dr. Whom? Ilham.
Hello?
Are you ready, Dr. Ilham?
Yes.
All right. Let's do the next one or the last one. Yeah, read your question, please.
I'm ready, doctor. I'm ready.
Are you talking with me?
Yeah, I'm ready. Yes.
You are ready, okay. Sorry. Okay, no worries. Just give me a second to start with, start.
Hello, my name is Ilham. I'm one of the doctors in that clinic. Could you confirm your name and age for me, please?
I'm Helena Watson and I'm 15 years old, doctor.
Could you tell me how can I call you?
Helena is fine.
Hello, Helena. Could you tell me how can I be of help today?
Well, I want to discuss with you having contraception, doctor.
Okay. So could you tell me more about your concerns and what want you know?
Well, I'm aiming to take contraception, but I don't know what should I take and how should I take it, and I want a prescription for it, please.
Okay, I see. So since when you are sexually active?
Well, I'm sexually active this year.
This year, okay. Could you tell me about your relationship? Are you feeling okay with your partner?
Yeah.
Okay. How did you meet him?
Sorry?
How did you meet him?
Well, he's in my school. He's the teacher in my school.
Okay, so everything is okay regarding this. Yeah, everything is consensual.
Yes, everything's okay.
Okay, so are your family aware of this relationship?
Are you?
Your family aware of this relationship?
No, doctor, and I don't want them to know.
Could you tell me why?
No, they are strict and they are not going to accept this relationship, so I don't want them to know. Are you going to tell them, doctor?
No, no. I don't want. I will not tell them, of course. Just let me take some more information regarding your sexual health and general health to be able to help you. Is that okay?
Okay.
Okay. So, could you tell me when was the last relationship?
It was 1 day ago.
Okay. So, have you ever? It was protected. Have you ever used condom or something like that?
No, he doesn't like using condom. That's why I'm asking for the other contraception.
Okay. Could you tell me when was your last menstrual period?
2 weeks ago.
Okay. Actually, Emma, could you tell me if you ever had any symptoms at all, pain or bleeding or anything?
Pain where? No,
From down below or bleeding?
No.
Okay, so have you ever had any sexual transmitted infection?
No, doctor.
Okay. Actually, in my, the good thing is that I can help you with your concern. I will give you an emergent pills that will prevent pregnancy. Actually, you are first thing I will do a pregnancy test for you to make sure that no, you are not pregnant by any chance, and then I will give you medication which it's pills that would prevent pregnancy. It's emergency pills, and actually, unfortunately, I have to tell you that this relationship is illegal according to the UK law. Am I clear so far?
What do you mean by illegal, doctor?
Actually, it's not your fault at all. I can see that you are happy with this relationship and you like him, but it is illegal to have in relationship with as you mentioned that he's your teacher, so it is illegal. It's a big difference in age, and he's someone of responsibility. He shouldn't do this relationship. Am I clear so far?
Okay, so what are you going to do?
Actually, it's my duty. I don't want to harm you at all. Just I want to do the my duty, which is I am gonna tell social services.
Okay.
Regarding the
What are they going to do, doctor?
actually, they are going to discuss this with you to stop this relationship. If you consider stopping this relationship, just tell me, Elena. What do you think of this?
I'm not sure, doctor. I'm not sure. Are they going to tell my mom and my dad?
Actually, they will take the best options by talking with you about this relationship, about its risks. Actually, it's a risk to have this relationship, even he don't cause any harm for you.
2 minutes.
It might cause harms in the future by doing other relationship with others on the same age in the same age. Would you consider stopping this relationship, Helena?
I don't know, doctor. I don't know. I'm just scared. I'm scared, doctor.
Scared of what? Could you tell me what's worries? What's your worry?
You're telling me that it's illegal and you are going to involve someone else. I
Actually,
didn't do
there is no
anything
harm in
wrong.
you. No. As I mentioned, Elena, you are not on the risk age. Actually, his fault, and you are the victim here. So I don't mean that you did any mistakes. And I will not tell your family. Just try to talk to them to be aware of these things to help you regarding this time. And actually, the social service will just discuss this with you and with him as well to prevent this from happening to any other girls.
Okay, all right, doctor.
And actually, we need to see you you have to if you come to our clinic many times to confirm that you didn't get harmed by doing a pregnancy test in the future. I know that you don't want to be pregnant. So just to take the emergency pills, and if you consider any practicing tests in the future, just consider making an appointment for taking contraceptive pills or any contraceptive methods, and try to practice safe sex to prevent any sexual transmitted infection from happening.
Time's up. Okay. Thank you, Dr. Ilham, right?
Yes, doctor.
Okay, so how do you feel?
I feel that I know the knowledge, but I can't make it an arrangement.
You mean being organized?
Yes, I do understand what should I do, but I feel that I do randomly.
Okay. So, okay. So did you practice this case before, or this is the first time for you?
Yes, I did, but it was organized. It was a month ago, and I was organized as it was recently revised, but it's been a month since then.
Okay, no worries. No worries. Okay. So you touched on the main points in the case, okay, but you just need to organize your mind to be able to address all of the issues of the case, okay? So what is the issue of this case, doctors? What are the issues? This patient is 15 years old, okay? 15 years old means that she is minor, right?
Yes.
And she is asking for pills, contraceptive pills, not emergency. Okay?
Yes, yes.
She's asking for regular contraceptive pills. You can give her an emergency pill, as you said. You can give her an emergency pill, but you also counsel her or give her the regular contraception.
Yes, I mentioned that in the last. I mentioned this. I mentioned this in the last of the consultation.
What did you mention?
I mentioned about you can take any contraceptive method after finishing the consultation. That was my last words.
Okay, maybe because there's a noise around you, maybe your child.
My baby,
Okay.
yeah.
Yeah, let's
But I said yes.
Okay, no worries. Okay, but you didn't ask her if she has any medical condition, anything
Yes.
that might affect your decision in giving her the
Yes.
contraception, okay?
Yes. Yes.
She might have migraine,
Yes.
right?
So contraindicated. Yes.
Yes, so you can't give her combined oral contraceptive pills or any combined method. You give her progesterone only, okay?
Yes.
So
Yes.
it's important to ask this question in your data gathering to decide which contraception and also to be organized in giving her the advice, okay? All right, so this patient is asking about contraception. So you tell her, well, okay, we can help you in that, but do you know what is the meaning of contraception? You have to make sure that she understands the situation. Why? If she doesn't understand, she is vulnerable. So with involvement of the safeguarding, you might consider telling her parents.
Yes.
She doesn't have mental capacity, okay?
Yes.
In
Yes.
this case, she has mental capacity, but ask her, all right, that's all right, we can help you in that. But can you tell me, do you have any idea why people use contraception, or do you know what are they for? Okay, for
Yes.
preventing pregnancy. All right, okay. All right, Helena, it's fine. We can talk about that. Do you use any contraception at all? Yes, doctor, or no, doctor. She doesn't use anything because he doesn't like condoms, or whatever the answer is, okay? Then you tell her, all right, some questions about your sexual life, it will be related to the discussion. It will help me in helping you um, in prescribing the contraception. Then ask about, are you sexually active? When was the last time? With a stable partner or not? And let me share with you quickly the mind map just for you to follow me. Okay, so you have to check her mental capacity. Then you ask about sexual history. Is she sexually active with a stable partner or not? And do you practice safe sex if you didn't ask from the start? And then you ask about her partner. how did you meet, or who is her partner, because she is less than 16, she is minor, okay?
Yes.
What about your parents? Are they aware of, and change your tone of voice, be more friendly, okay? Don't ask the questions in a way that scares the patient, especially that
Yes.
she's young, she's minor, she's afraid of everything, she's 15.
Yeah, this is
Yeah.
my problem in every case. I find difficult being friendly in
Just
English.
change,
Actually, I'm so
play with,
friendly in Arabic.
yeah. So play with your tone, with your facial expression, and just lower your tone of voice a little bit. Be more friendly with your tone of voice. So,
Okay.
well, Helena, okay. So I can see that you are 15. So are there your parents aware of this relationship? Okay. No, doctor, I don't want them to know. Okay, no worries. It's fine. It's fine. It's totally okay. And then you can ask her about the other, the contraception itself. Which one would you like to prefer, or did you do any researches about it? Okay. Did you complete your family? This is if the patient is, adult. Okay, so these are general questions in all of the cases. So you pick up the questions that are relevant to the case. Okay, these are relevant to the case. With you can ask, which one would you like? Would you like pills, injectables, patches? We have many things. Okay, and once you find that the partner is adult, okay, or position of trust, try to move on to the management as much as you can, quicker as much as you can. Okay? So after you find a partner, you tell her, which one would you like, pills or injectables? Do you have any medical conditions? Okay? And then when was the last menstrual period? Okay? And then you move on to the management. Why? The management will take time.
Yes, I was afraid that it might be pregnant, so I have to prevent pregnancy, not to get harm. Like if she become pregnant by any
Yeah,
chance.
you do the pregnancy test.
Yes.
Okay? You do the pregnancy test. All right? These are the points in the management. In this case, you do the pregnancy test. You can offer her emergency contraception for now. And you tell her we will start with something called progesterone-only pills because you have migraine. Just give me a second. Okay, doctors. All right? So, pregnancy test, offer her emergency contraception, and you tell her we can offer you also regular contraception called progesterone only contraception, okay? Because you have migraine, okay? And then involve the social, not social service, child safeguarding team. Okay? And you can tell her, I would encourage you to tell your parents about it because this relationship is illegal. As you said, it's illegal, okay? And you were reassuring me that this is not my fault and it's the fault of the teacher. The way you reassured me about the teacher and the relationship, it was really nice. Okay?
Pardon, doctor. Sorry, repeat this again. Sorry, I couldn't hear you.
I would encourage you to tell your parents about this relationship. You will find much support because I can see that you are fearful. Don't worry, it's not your fault at all. It's the fault of the teacher, okay? But in these situations, we would encourage the girls to talk with their parents, and if you would like us to help you, we can offer you that. And telling your parents. Okay?
Okay.
Yeah, this is how to talk or how to convey to her, telling her parents. Is it mandatory to tell her parents? It's not mandatory, okay? In this case, she has mental capacity, okay? And you will involve the safeguarding team regardless what is the she has mental capacity or not. Okay, the safeguarding team will deal with the situation. They might tell her parents, they might not, but you as a GP, you reassure the patient that from our side, if you don't want to tell your parents, it's fine. Okay, discuss that with the safeguarding team and they will give you the best solution for this situation.
So I said that they will not tell your parents. Is that right or not?
Okay, they might tell, they might not, based on the investigations that they will do. Okay, it's
Yes.
not your job to tell the parents by yourself as a junior GP in the GP practice. It's not your job to go and tell her parents, especially that she is mentally capacitated.
No,
Okay?
I mean that you've asked me that if they are going to tell my parents, what is the answer? Sorry. You've asked me as a patient,
Okay.
social services, are they going to tell my parents? So what is the
Okay.
answer?
All right. So the answer is that, well, okay, their aim is not telling your parents or not. Okay, their aim is making sure that you are safe. They will talk with you. They will investigate the situation, and they will talk with him as well, and they will take the best solution and the best option for you after the discussion with you. That's it.
Okay. Thank you.
Okay.
Okay, thank you.
All right.
Doctor,
This is
both
how
or
to answer
fail,
the question smartly. Yeah.
pass or fail this case.
Sorry.
Pass or fail this case.
Pass or fail? Well, it's borderline, to be honest. Okay. You didn't check if I have medical conditions or not, because this is she came for the contraception, for regular contraception. Okay. So
Okay.
you have to find out if is she eligible to take regular contraception or not, and giving her the right option. Okay. And this is the first thing. Then you can offer, so you did offer me emergency contraception and pregnancy test, social services, and also you can send her for STI screening.
I mentioned STI.
You told me to be screened for the STI, sexual transmitted infection.
I've mentioned if she has any symptoms, and I've asked her, have you ever experienced any sexual transmitted infection?
Yeah, but even if she doesn't have symptoms, you will offer her to go to the sexual clinic.
Yes. Okay.
Okay, the gum clinic. Okay, to be screened for she did have a unprotected sexual intercourse with someone. Maybe he has previous relationships with others. You don't know. Okay, and the STIs usually don't
Have symptoms
asymptomatic
immediately.
in most
Yes.
of the cases. Okay.
Okay.
Yeah. All right. So pregnancy test, emergency contraception, offer STI screening, safeguarding team. Okay.
Okay.
And then encourage her parents to know about the situation. Okay.
Okay. Thank you, doctor.
Thank you, Dr. Ilham. All right. So the main two issues in the case are finding out the best option for contraception in this patient, and safeguarding team for this minor patient who has sexual relationship with position of trust. Okay. All right. So this was the last case. I'm going to answer your questions. Please, before you go, if you don't have any questions, please submit your answers regarding the feedback, please. And how did you find the session? And yes, see you inshallah soon. Yeah. Bye bye.